Hi, today we're going to talk about gallstones and what happens if they're not treated. So first of all, out of 100 people who've got gallstones, only 10% actually need an operation. Those 10% are people who've had symptoms, who've had complications. Those are the only group of patients that actually need an operation. If you have symptoms and the gallstones are not treated, obviously one can develop complications such as pain, which is the least problematic complication of gallstones. It's pain that lasts about 45 minutes to an hour and a half. It normally then subsides either with or without taking painkillers, and then it reoccurs at a set point of time in the future, mostly after eating fatty meals or dairy products. This is the classical symptoms of what's considered biliary colic. If the pain is more pronounced or it's more severe and it's associated with symptoms such as fever, nausea, then one is looking at the next, in the gradation of complications, the next step up, which is infection of the gallbladder, i.e. cholecystitis. These in general require admission to the hospital and treatment with intravenous antibiotics. These cases, if caught within the first 2 to 3 days of onset of symptoms, should be treated in the hospital if possible. Longer than that, personally, I leave patients alone and then subsequently treat them after 4 to 6 weeks when all the inflammation has settled. The next step up from the complications, increasing the severity of the problems that arise. If the gallstones are left, we'll be looking at jaundice, which means that the gallstones actually blocked one of the bile ducts, and the bile then cannot flow into the bowel. It actually flows back into the bloodstream and gives you jaundice. If that column of bile, which is obstructed, gets infected, it leads to what's called cholangitis, which potentially could be life-threatening. The other complication is if the stone actually affects your pancreas, it can lead to pancreatitis, which is a spectrum of conditions from mild to severely life-threatening with with multi-organ failure. So the seriousness can be ramped up if one has symptoms and the stones are left behind, and one cannot predict when these problems can arise. Another complication, if the stones are left behind, is perforation. It is relatively rare, but the stones can perforate from the gallbladder. It can cause pressure on the wall of the gallbladder, causes lack of blood supply in that area, and then it can perforate. Again, this is a surgical emergency requiring an emergency operation. In summary, to prevent problems like perforation, cholangitis, pancreatitis, all of these things, one would recommend an operation to remove your gallstones once you develop symptoms related to your stones.